All right, let's talk about a billing code that causes more headaches and denied claims than almost any other. We're going to crack open CPT code 76942 and figure out how to master it once and for all.
So does this sound familiar? You're a clinician, you're a coder, and you see this all the time. You do a perfect joint injection, everything goes smoothly, but then, bam, the claim gets denied. It is such a frustrating cycle, and it costs your practice real time and real money.
Well, here's the thing. The secret to getting that claim paid often isn't about the main procedure code. Nope, it's all about its essential partner. This one little add-on code that proves the skill and safety you brought to the table. You know, every time you place a needle, you're navigating a pretty high-stakes environment. Doing these procedures blind with no visual guide, it's kind of like trying to park your car in a super tight garage, but with your eyes closed. You wouldn't do it, right? Because without that guidance, the risks are huge. I mean, you could hit a nerve, you could damage blood vessels, you could miss the target completely. And that means the treatment doesn't work and it causes the patient a whole lot of unnecessary pain. That's exactly why image guidance isn't some fancy luxury anymore. It's become the standard of care. Okay, so how do you actually get reimbursed for using that guidance? That's where CPT code 76942 comes in. The absolute best way to think about it is like this. It is the GPS for your needle. It's how you tell the insurance companies, hey, I used technology to see exactly where I was going to make sure this was accurate and safe. And here's the official definition from the AMA. I know, it's a bit of a mouthful, but the key phrases you got to focus on are ultrasonic guidance, which means you're using the ultrasound in real time as it's happening, and imaging supervision and interpretation. That means the doctor is actively watching that screen and making calls based on what they see. Now, this is so important to get right. CPT 76942 is not for the injection itself. It's not for the biopsy or the aspiration. No, those things have their own separate codes. This code is only for the work of guiding the needle. And that brings us to the most important rule of all. 76942 is an add-on code. Let's go back to that car analogy. The main procedure, the injection, that's the car. The ultrasound guidance, our code 76942, that's the GPS. You can't just bill an insurance company for a GPS by itself, right? It only has value when it's with the car. It's the exact same thing here. This code can never, ever be billed alone. So who's actually using this procedural GPS day in and day out? Well, the answer is a lot of people. It's used across a whole bunch of different medical fields. We're talking about pain management docs doing super precise nerve blocks, orthopedists hitting the exact right spot in a knee joint, anesthesiologists use it for regional anesthesia, radiologists for biopsies, rheumatologists for draining fluid. I mean, the list goes on and on because the benefit is always the same. It makes the procedure more accurate and way safer. All right, now for the part that really matters, making sure you get paid for your work. Because using the code is easy, but billing it correctly, that's where things get messy. For 76942, the absolute golden rule is this: documentation is everything. Think of it this way. Your note has to paint a crystal clear picture for an auditor. You have to spell out why you needed the ultrasound, what you were aiming for, exactly how you guided the needle, and then confirm that you hit your target. And step 5? Oh, that one is completely non-negotiable. You have to save a permanent image to the patient's record as proof. No image, no payment. It's that simple. So let's make this really clear. You can bill 76942 when you're guiding that needle in real time. You save that picture and you bill it with a primary procedure. You cannot bill it if you just use the ultrasound to look around, for diagnosis, or if you forgot to save an image. And here's a big one people miss. You can't bill it if the main procedure code is bundled, meaning it already includes payment for guidance. And following these rules isn't just about checking boxes. It's about protecting your practice's bottom line. Every single time a claim for 76942 gets denied, that's money you've lost for work you actually did. So let's look at the most common traps to avoid. Okay, the number one biggest mistake, hands down, is billing it all by itself. Remember, you can't bill for the GPS without the car. The second is forgetting to save the image. After that, we see things like really vague documentation, using the wrong modifier, or trying to pair it with a code like 7697 for vascular access, which already includes guidance. So what's at stake here financially? Well, depending on who's paying, a single mistake on this one code can cost your practice over $150. Now, multiply that by how many GANDed procedures you do in a week, or a month. Yeah, it adds up incredibly fast. So after all this, what do you really need to remember? If you want to protect your practice and make sure you're getting paid properly, it really just boils down to 3 simple essential rules. Here they are, the 3 golden rules. 1. It's an add-on code. It always needs a primary procedure buddy right next to it. 2. Your note must clearly describe watching the needle being guided in real time. And 3, you must save a permanent image. If you just follow these 3 rules every single time, you will wipe out the vast majority of your denials. I promise.
So I'll leave you with this question. If an auditor walked in tomorrow and asked for your charts, would your documentation for CPT Code 76942 hold up? Is it a clear, undeniable record of the skill and precision you used? If there's any doubt in your mind, now is the perfect time to fix it.